Roots of the brachial plexus exit the spine, traveling over the transverse process. The roots traverse between scalenus anticus and scalenus medius. The scalenus anticus lies under the medial edge of sternocleidomastoid muscle. The internal jugular vein travels under the medial edge of the clavicular head of sternomastoid. Scalenus anticus and scalenus medius sandwich the brachial plexus and subclavian artery between them and have their attachment on the top surface of the first rib. The interscalene block is done at the level of cricoid cartilage and is at the level of the roots. The roots of the brachial plexus travel close to each other and confluence at the lateral border of the scalene muscles to form the trunks just above the first rib. This is the location of the supraclavicular block. Some of the branches of subclavian artery may cross the brachial plexus just above the clavicle. These are the transverse cervical artery and the suprascapular artery. One may be able to visualize these vessels with ultrasound. The phrenic nerve curves around the lateral border of scalenus anticus and travels on its anterior surface. Some branches of the brachial plexus perforate the scalenus medius and go to form suprascapular nerve and nerve to the levator scapulae. Scalenus posterior lies behind scalenus medius. In the cross-sectional view at the level of the cricoid cartilage, the top of the screen represents the ventral side of the neck. The trachea is represented as an ovoid structure anteriorly. The pretracheal muscles are seen anterior to the trachea. The thyroid gland is seen on either side of the trachea. The sternocleidomastoid muscle is situated more laterally. The carotid artery and internal jugular vein are seen covered by the belly of the sternocleidomastoid. The vertebral body is seen posterior to the trachea, separated from it by the prevertebral muscles. The spinal canal with the spinal cord is seen posterior to the vertebral body. The roots are seen to leave the spinal canal through the intervertebral foramina over the transverse process. At the lateral edge of the transverse process, the roots are sandwiched between the scalenus anticus and the scalenus medius muscles. These muscles are seen under the lateral edge of the sternocleidomastoid muscle. The scalenus posterior lies posterior to the scalenus medius.